Hey everybody, my name's Sean Gray. Excited to be here. I know I've been in class with a lot of you. Um, what knowledge am I bringing into NU665C from previous psych mental health MP courses? I would say a very solid and strong foundation in the psychiatric assessment, psychopharmacology, evidence-based treatment planning, completing psychiatric assessments, formulating differentials, developing strong therapeutic relationships with patients. And I feel very confident in all those and prepared to be at this stage. I would say I don't really need any further clarifications on concepts that were previously covered. I think at this point it's just taking the skills we have learned, homing in on them, and converting them into practice and just strengthening ourselves to be ready to transition from the student role into psych mental health NPs and very competent practitioners. I am currently working at Mass General Brigham. I do virtual urgent care. It's a system I helped them set up during the COVID times. My history, work experience mostly includes ER and urgent care. I was also in the Air Force, so aerospace medicine. Uh, I have a background in surgery as well. I was born in Weymouth, Massachusetts, which is just south of Boston. My hobbies include hiking, exercising, spending time with my family. Something unique about myself. I don't really share this with everyone, but being in a medical program, I have a child who was born with something called CMN and NCM. It stands for congenital melanocytic nevus. So he has basically a giant birthmark and melanin deposits throughout his body. Um, it's part of the reason why I came back to school. A lot of patients with CMN obviously have some problems, and it's usually recommended that they see a therapist due to life transitions and dealing with their illness. So, nothing to be sad about. We treat him like any other child. He's, a joy. Um, so loved too, but that's kind of something unique that I figured I would share with you guys. I hope to be practicing in a some sort of addiction medicine when I graduate. So dual diagnosis program, even inpatient programs for rehab and detox. I do have a strong passion, as most of you probably know, as we've shared classes together for addiction medicine. How would I define age-appropriate psychological well-being? I define it as being able to be developmentally appropriate, but also confident and I don't want to use the word happy, confident and I guess okay and where you are in life. We're all going to have struggles and run into certain things where our psychological well-being will be tested. And I think a good way to define that is, how is our resilience? How do we handle those situations? For some people, it's definitely easier than others, or with patients with psychiatric diagnoses, they might handle situations or um, have a bigger toll on their psychological well-being depending on where they're at in life. My favorite developmental theorist, I'd probably go with Erickson just because I feel like we learn the most about him. I feel like we spent a lot of time, especially throughout this program, especially to the point where things have stuck at this point. starting off with trust versus mistrust and going all the way to generativity versus stagnation. I feel like there are things that, I can assess a patient at this point and understand what developmental stage that they should be in, which is a good thing, and I think will help in the long run. Um, I'm excited for a great semester with everybody, and good luck to everyone.